welcome. Glad to have you on this interview. It's the first one of the year for 2025. Um, Mentorship Mondays, it's something that has been ongoing where different persons from different career paths share their insight with persons who are interested in different career fields, as well as if they're not sure what they want to do, they can, tune in, get some advice, ask some questions, hear different stories and all. So you know it go, but it's just kind of introduction for all persons who are probably joining for the first time. So let's get straight into it, as I said. You hear me clearly? All right. So my first question to you: when did you realize that you wanted to be a drug dealer?
It's a legal drug
As a
dealer.
pharmacist, introduce yourself for me, please. And a little broad.
Um, so as you're aware, my name is Jerome Fray. I am a pharmacist and the chief pharmacist at Bright Hope Pharmacy, which I basically deal with the runnings of the day-to-day running of that pharmacy at the moment. I've been practicing for 7 years as a pharmacist. Um, so let me just dive into how I became a pharmacist or
Yep.
how, yes, I really went into the pharmacy field. So um, it started when I wanted to become a
Mhm.
medical doctor. So in high school, I went to St.
All right.
At the time, St. James
So,
I didn't offer.
yeah, the phone kind of glitched a while ago. Yeah, go ahead.
Okay.
Hmm.
I was saying that I went to St. James I. At the time, St. James I didn't offer all the science subjects. So really, I did business there. And when I was doing business, I was like, from as a kid, I wanted to do to become a medical doctor. I want to do the sciences. And so the teachers are pushing me, no, but Jerome, you're very good in business. Why not, focus on that? So I was like, no, 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 I don't want to do that. So while in 11th grade, after I graduated, applied for sixth form at Herbert Morrison. Went to Herbert Morrison, but at the same time, I was like, okay, I know I'm going to Herbert Morrison, but I know that I'm not going to stick to business. So I started doing the science courses. So, but I did get biology in St. James I. But when I went to Herbert Morrison, that's where I did chemistry in CXC. It was first sixth form year. I did chemistry and I did physics, and it was in that year my mom said to me, what about doing pharmacy? I was like, pharmacy? She was like, yes, pharmacy. And I kid you not, a couple of days afterwards, I heard on the radio that there was a shortage of pharmacists
Yeah.
in Jamaica. I was like, wait, what? Is it the same thing what I talk about? So I decided to do some research. I'm like, all right, let me go find out what it is. And I went online, do some research. I said, all right, pharmacists, they know how drugs work, and they're a health professional, deal with um, dispensing medication. I was like, okay, the side effects of drugs. I'm like, this sounds very interesting. And already I was appreciating chemistry, and it was a heavily based chemistry profession. So I was like, you know what? I think I like this, and it sounds
Yeah.
like job security. So I was like, you know what? I'm going to do pharmacy. So that's when I decided, all right,
Mhm.
I'm going to apply for pharmacy school at UTech. At the time, only University of Technology offered pharmacy um, as a professional as a course. It's now been it's UWI, UA. So you can do pharmacy either UTech or UA at the moment. But back then it was only UTech. So I tried to finish up the CXC's subjects, the science subjects in sixth form, first year sixth form, and the following year was a bit of a challenge because the school didn't want me to do both CAPE units of chemistry in the 1 year, which I don't think was ever done before at Herbert Morrison. But I had a good chemistry teacher the year before who taught me the 6E chemistry. So she was like, all right, I'm gonna give it a go ahead. Let's try this and see. And well, when she gave me go ahead, I did my best. My best foot forward, and I did get distinction in chemistry. And that's how I was able to get into pharmacy school. Um, and even at the interview in pharmacy school, that was one of the points that they really liked, that I was able to do both units in 1 year. Yeah, man. So that's really the backstory of how I,
Okay.
yeah.
So it was you were an exception in terms of doing the 2 units in the 1 year. Was it based on the interest you had and the desire to do it, or it was recommendation based on what you've done before?
It was the desire and interest because I didn't want to waste any more time. I didn't want to leave Herbert Morrison not having the CAPE subjects. Because it would mean that I would have to go to either community college or something afterwards in order to finish these courses to get
Okay.
into pharmacy
Um,
school.
yeah.
Like, it's best to try and finish up and get
Yeah.
as much as I can at Herbert Morrison so I can move forward.
So you mentioned business. That you were into business before. What what changed that mind, that thought process of going into business and going into medicine?
Well, the mindset, if funny enough, the mindset of medicine was always there. It just that when I went to St. James,
Only
they did not offer all except biology, all the science courses. I think they do now. They do have chemistry and physics at the moment, but at the time they didn't. So it was one of those things. And if you already in high school and you have to select a course. So it's all right, maybe accounts and business, which I was very good at the time. You really want to focus on these courses because you're in 11th grade. I did 9 subjects, so you really want to focus on what you're doing at the time. So it was afterwards when I still went to sixth form. I was like, all right, now it's time. Now it's crunch time. Time to get the ones that I
Okay,
needed.
cool. So for you, it would have been like an earlier out. You decided what you wanted to do from the beginning of your secondary education. Uh,
Yeah, man. But the thing is, I made the switch to pharmacy because it was always medicine and becoming a doctor. And like, you know what? Let me try pharmacy school.
yeah, don't regret. Yeah, man. And I was pointing that out because sometimes um as students in secondary level, you may even reach grade 11 and you still don't figure it out. Which is not necessarily, it's not a bad thing. It's just that you probably have too many options, or you feel as if there's something else that is calling you, that is your passion, and you may discover that even after high school. But fortunately for you, you saw the direction which you wanted to, regardless of the limitations. And, yeah, perseverance.
Yes.
That got you to where you are.
Yeah, but
Cool, cool.
yes, it did.
So,
It did.
what is a typical day for you as a pharmacist? What does that look
Well, a typical day. My day is a little bit different from most pharmacists in that work starts a little bit earlier than usual. So for me,
like?
the pharmacy opens at 7 in the morning and we close at 6 in the evening. So I have to be there by 7 a.m. And because, well, there's a doctor office close by. He opens early just the same, just to facilitate, persons going to work or want to see the doctor before going to work and all those things. So we do open a little bit early. But on a day-to-day basis for me, dispensing, talking to patients or customers, giving advice, a lot of advice to customers and patients that comes in. And want to know general information about their prescription, how a particular medication work. But a crucial and a big part of my day is also inventory management, which involves ordering, stock taking, looking out for expired medication, expired drug, and on a day to day, just ensuring that you're well stocked on a day to day. Because even though you're practicing and you're counseling patient, you have to have what they need in order to counsel them about a particular job. Yeah. So that's pretty much my day.
You mentioned having conversations with patients. Do you encounter any time where patients would question prescription or they want to tell you what they feel as if maybe they can prevent advice from other pharmacies or what is the word?
Mark you, practically almost every day a patient
Yeah.
will question their prescriptions or their prescription. And it's a lot of things, but hear me out now. So a patient or a customer will go to a doctor. They'll see the doctor. They'll go in and they'll be like, hey, doc, I'm feeling some pain, or my pressure is a little bit high, or it's usually, I think may have sugar or something. The doctor will test them, and I say, okay, fine. What else are you experiencing? And they tell them, or they may not tell them, and the doctor writes a prescription. They say thank you, and they leave. Now, when they come to us, this is where they feel most comfortable talking about their illness, their prescription, what they're going to do. So now it's my job or the pharmacist's job to basically go through the prescription, go through their illness or their concerns that they have. It's always the case, many a times, almost every day we go through that. So they will come, the doctor prescribed that. What that used for? I don't know this one. Oh, so what about this cream? What am I using it for? No, sir, I'm not having any itch. I'm not having any scratch. And then you have to say, okay, did the doctor talk to you about this? And they're like, yes. And they're like, okay, well, this one, this medication you use for that. And they're like, oh, so it's gonna work? Yes, it's really work. But you know what trouble me? What kind of side effects are you have to explain to them, which is a big part of our profession too, is knowing drug, know how to use them, how they work, and their side effects. So in a nutshell, that's basically what we do on a daily
And
basis.
it has to be you have to be very meticulous because if I was to, I always look at how customer service is in Jamaica, especially in food. And have you ever gone to like a, let's say, a restaurant or somewhere buying something and then you're wrong? You go to and then give original chicken and other barbecue. That cannot happen in the pharmacy. It can't.
No. So
Yeah,
no, it can't, it should not. I mean, we're humans. It, you might find an off chance where it may
yeah,
happen, but not on a no, not a regular thing. But because you have to put some check and balances in place um,
right.
in order to ensure that you don't make these errors. So when I get a prescription in hand, there's a lot of that going through my mind at the same time. I look at the name of the patient, mark here. I look if it's a male or female patient.
Yeah,
I look at the age of the patient. I look where the prescription, even I look even where
yeah,
who's writing the prescription. Is it a gynecologist? Is it a
yeah.
general doctor? And then look at the medication they're giving. And then you definitely proceed to ask the patient questions at the same time. And you can look and know what you're doing or what the medication is used for, if it's safe or if it's giving out the correct
So in
dose.
other words, your proof
You go through
reading
all.
and checking what the doctor would have specified or prescribed. So That means they have a little
every
more
day,
knowledge than
every
us
day.
sometimes.
'Cause
So,
the thing is, we in terms of
mhm,
drug and medication, we are the experts
mhm,
in that department. So we do sometimes have a little bit more knowledge than the doctors. Because mark you, on a daily
mhm,
basis, a doctor will call you for questions I ask you about how a particular drug is dosed and how it is given, how long it can be given. So while they focus on diagnosis and I mean, of
yeah,
course, drug use and drug treatment, we are the experts in
yeah.
how the drug works, the side effects, as I said before, and how it
Mhm.
is used. So the dose, how long, the duration.
Okay.
That's our specialty. And so the check analysis come from the moment that the patient hands in the prescription to when you're about to dispense this medication. So what we do,
Mhm.
we check what's on the
Okay.
prescription, check the item, open the box. We literally count the amount of tablet, look for the dose of the tablet to ensure that what the doctor wrote
Mhm.
says maybe 10 milligrams of a drug. A lot of folks know 500 milligrams. We say 500 milligrams because there's a 500 milligram dose on the box or on the drug, and we count them even. And while we're handing it to the patient or dispensing to the patient, we are telling them how to use this particular drug. And at the same time, while we're telling them how to use it, we're also checking and reminding that this is the drug that the patient should get. If this is 500 milligram, and this should be taken
Okay.
twice daily. So there's a lot of check and balances we do
Okay.
mentally while
Um,
we're there.
there was a question in the chat. How do you stay updated with the latest drug information and guidelines?
Okay, yeah, man. So, latest drug information and guidelines. There's always what we consider CE or CE
Mhm.
is a continuing education program that we
Yeah.
have to do 12 credit courses every year in order to to get re-registered or
Mhm.
yeah to get your license the following year. And most of the times these courses maybe a couple of hours of different treatments or different conditions or courses on different conditions with updated guidelines. So you will get the information from there when you have a forum or the continuing education with these updated guidelines. And we prescribe to a certain app or
Okay, we have
Medscape.
different
We come
apps
out with
and
different
websites.
new information.
Okay. Is this for general
Yeah,
public or is it something that you be privy to as a family?
it can from the size of a general public, but they'll ask you to register, and most of the time you register as a pharmacist, and they'll provide
Oh,
information geared towards
okay,
your
okay,
profession.
cool, cool. Before I go to the next question, you mentioned earlier that when you were going into the career, when you're deciding that this is what you wanted to do, you heard of an ad, pharmacists were needed and so. Um, how is that going now? What is the scene like? And is it still a need, or especially with technology taking over AI and all of that stuff? What's the scene like as a pharmacist?
Even though AI is taking over, as you just mentioned, in the first world countries, here in Jamaica, it's not being broadcasted on the radio
Yeah,
and the TV as how it used to. But there is still a problem. There's still a shortage. I
yeah.
mean, from my end, my opinion, I've seen where it is still a problem to get a pharmacist to cover a particular shift or to to
Is it because
to register a
of
particular
the
pharmacy.
hours, or
'Cause,
is it because
in the past,
of- oh,
there's just
okay.
not enough of us. One of the concerns or one of the main problem with that, I mean, probably here growing up in school,
Mhm.
something they call brain drain. I think that's one of the issues that might be causing it because I mean, a lot of pharmacists, when they do finish, they'll go to the US or to Canada to further their education and to
Yeah.
practice in the States or in Canada. So the amount of pharmacists you get or leaving school is not the same amount that stays
Okay.
in Jamaica.
Okay. So it's just like many other professions like teaching and yeah. Okay. Would it also
Yeah, man. But sometimes we do have challenges in finding persons to cover shifts. So if persons on there looking to go into pharmacy, just remember the one thing, job security.
yeah.
You sure?
Well, see that you mentioned that no, you need to know if and it may not be total figures, but it's sure, but is it enticing, you know, and in terms of the salary and stuff. Yeah, man. Because
In
we're going
terms
to do this, we need to know if we can invite the stress on ourselves and get good pay.
All right, so it's been a battle in terms of pay in the past
Hmm.
couple of years with pharmacists, but this is public knowledge as we speak about there's a freelance rate. Um, um, at the moment, you can hire a freelancer, and these are pharmacists that are not tied to a particular pharmacy or register a particular pharmacy. They do hours at the pharmacy, and you can pay these pharmacists between, well, it's risen recently between 1,800 to
Okay.
2,500. Let anyone do the math from there as to how many hours you can work. But so you can put your pot on
All
the
right.
fire, man.
Sound good, sound good. So persons should be encouraged now, even if they were thinking of the financial aspect of it, you know, because you know it's not a field that you just get up every day and say you want to become a pharmacist. Some person could be a doctor, some people say, you know,
Yeah.
therapist and stuff like that. There was another question. What is your biggest challenge as a pharmacist?
Challenge as a pharmacy. Okay, that's a good question. And it probably goes back to the one I mentioned just before this is finding a pharmacist to cover a particular shift. I think that's one of the
Yeah.
biggest challenges we have at the moment. Well, I have at the moment. So if you're sick or you have
Hmm.
an emergency, it sometimes gets difficult in finding someone to just, cover for you. Or let's say you want to go on a vacation, if
Yeah.
you literally have to search for persons out there to cover that shift. So that's a big challenge I have. And another challenge, I wouldn't say a challenge, but you have to be able to manage a pharmacy
Okay.
and manage the staff as well. And sometimes they do leave staff management up to the pharmacist or the chief pharmacist. Um, so you basically um, have on two hats, being a pharmacy manager and also the
Okay.
pharmacist.
Cool, cool. Um, oh, this question was pretty much asked earlier and answered. Like in the coming years, where you see the future of being a pharmacist or in the pharmacy profession. But you're answering there there's job for there's a a plethora of opportunities in that field. So should be good.
Yeah, man. You have to also consider this, and which I did mention, even if you do go to pharmacy school and become a pharmacist, there are lot of facets to pharmacy. There are a lot of areas you can go into. So you don't think about it as just being in a community pharmacy where you dispense medication. You have the option of becoming a hospital pharmacist. So you're more hands-on with different treatment, and you're more liaison with different doctors. You can become a clinical pharmacist. You have it's may seem far-fetched, but there is even a nuclear pharmacist who specialize in oncology, which is a cancer treatment. You can even become a med rep, which is a medical representative detailing different drugs or new drugs, and even go into the research area. So you don't have or manufacturing and distributing. There's another areas that you can dive
Okay.
into as a
And
pharmacist.
yeah, you're gonna say something?
But yeah, I was just saying that since I'm about technology, at the moment for us, I think Jamaica is 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 at the catching up stage when it comes to the pharmacy profession, unlike the developed countries such as the US. That's currently no, they do like e-prescribing or e-prescriptions where the doctor might send a prescription over a cloud or a software and it can be picked up by a
Mhm.
particular pharmacy which the patient desires to. So most times in states, uh, uh, usually you don't necessarily have to be walking around with a
Yeah.
physical prescription in hand. But here in Jamaica, stipulated by the Pharmacy
Mhm.
Council of Jamaica, which is our regulatory body, it is still illegal to dispense prescription that is not
Mhm.
physically present. So WhatsApp
Okay.
prescription, it's still not a thing. And a lot of people think it is, but yes, you can send in your WhatsApp prescription, but the patient or the doctor has to hand in the physical copy of the prescription within a prescribed amount of time. I think it's usually 3 days. It's 3 days they have to provide actual prescription. So we are not there as yet, but we are getting there. We're lobbying for that
Okay.
aspect as well, the e-prescribing. But for now, um, but technology, what I've seen though, for us, long before my time, um, persons used to, our pharmacists used to write labels for prescription. Nothing done on a computer. So now we have different softwares that can handle this for us. We have label printers, so we just type in whatever you want. The label shoots it out and we can paste those nice labels on the box or the medication. But what it also does is ensure that you have patient
Okay.
data. So we we store patient data, so we can know on hand, right on hand, how long you've been taking a certain medication, what medication you took the last time or last year, just by the different software that we have
Okay.
available at the moment.
Um, Going into the next question, what are some of, because you mentioned like a lot of different areas that you can go into, in the profession. What are some of the misconceptions in the field?
Misconceptions. I think one of the biggest misconceptions is that we are pill pushers. We count and sell
Yeah.
pills.
Okay.
Or we're just a shop checker.
I guess that's not good.
But yeah, man, it's one of the biggest misconception because a lot of what we have to deal with is ensuring that you, the patient, is getting the proper
Mhm.
medication at the right dose, taking at the right time, taking for
Mhm.
the right amount of time. So even though you see us behind the counter, I mean,
Yeah.
we do count pills, we do, but there's a lot more that goes on because a lot of time we do have to liaison or talk to doctors about a patient and their treatment or regimen. It's like we do call a doctor and say, hey, doc, I think this medication isn't the right one for this patient, or ask them if this is what they are confirmed, if this is what they want to give to this patient, and make our recommendations to them, and most of the times they do agree. So, I mean, of course,
Okay.
we are the drug
So
experts.
Yashibu have some questions for you, man, and they're some very interesting questions because leading off well from the previous question um about pushing pills and all of that, I guess that may be the least passionate part about the career, but you can tell me what are you most passionate about while practicing in the field?
For me, let's say that I'm a people person, so I'm most passionate about talking to the customers, counseling them, tell them every day you go in, sometimes you don't know how a patient is feeling. I mean, like I always said, especially to like if I have a new staff, um, when you see persons or customers coming
Mm-hmm.
in here, they are sick, they're not well, they're agitated, they're angry, they're
Mm-hmm.
feeling down, they're feeling depressed. They don't want to be here most of the time. I mean, that's if they're only coming here for some vitamins, not to boost them up. But most of the times, if they're there filling a prescription, I'm 100% sure they really don't want to fill this
Yeah.
prescription. No one wants to be sick. So if I can provide some sort of
Mm-hmm.
relief or comfort to these patients, for me, that really warms
Yeah.
my heart and make me feel better. And knowing that I can help
Oh,
that way.
yeah.
So even if it's just a smile, so I'm very passionate about
And
dealing with
that's a good
customers.
thing because
Yes.
especially dealing with health and you have some persons that based on their reason for visiting the doctor or visiting the pharmacy, they might be a little uncomfortable, or they might be a bit aggressive. You might encounter so many different things throughout the day, and having that, soft skill, being able to communicate with people, and allow them to be confident in what you're providing for them. It's very important. And it goes right across the board. Any career choice that any career that you're in and you have people, very important. A people person, all right. I don't want to say pretend you're a people person, but so that the experience that you get with that person, they can say, all right, they didn't feel cheated on, feel as if you weren't caring enough, towards them.
Sorry. Yeah, man. Because that's one of the things that they do teach us to try and have this. It's the soft skills
Yeah,
that make a good pharmacist. You know, most pharmacists, I think, all know how drug work, their side effects, and
yeah,
how they're used. But it's the soft skills that
right.
make you a good pharmacist, a better
Cool,
pharmacist.
cool, cool.
Um,
Um, I was also going to ask when I mentioned about the different like persons coming. How do you balance confidentiality with providing necessary health advice?
Funny enough, patient confidentiality. That we take real seriously in pharmacy is one of the things that when you go in pharmacy school that they really pound in your head about patient confidentiality. Um, so I'll give you this a simple scenario. So this case might be brought up sometime in pharmacy school where even if you
Yeah,
know Mr. and Mrs. Brown and Mr. and Mrs. Brown coming to the pharmacy all the time. Then one day you see Mr. Brown coming to the pharmacy to get like HIV medication, but you realize Mrs. Brown will come again, but she's not getting any HIV medication. And of course, you have she's buying something else anywhere else, and she's like, no, no, this is the only place I shop or whatever. You must not and cannot go to like Mrs. Brown and say, Mrs. Brown, why
yeah,
look good enough? You know, so what? No, it's the best you can do is go to the Mr. Brown and explain to him the risks or the problems associated with that. If he's telling his wife that this is the case, and ask him to get his wife tested and all of that. And so it's a really big part of what we do, and we take it real seriously. Because even in the pharmacy council, one of the regulations, one of the stipulations, in order to open a pharmacy, you have to have a confidential right beside the dispensary. There always have to be a door leading to that confidential room from the dispensary. So if persons coming in and they really want to have a private conversation, you provide the space. It's there. It's always there for them to go. You can go inside the room, talk to them, deal with the situation, so they can leave and feel comfortable. In what medication. It's almost like when you go into a doctor's office, you and the doctor alone in the office. You can have the same experience when you come to a pharmacy.
Um, so with that said, you would also foster a space or some form of comfort, when somebody comes, because I mean, if you are going to the doctor, that means it's not comfortable. People don't just go to the doctor and say, hey, doctor, I feel like I want to be sick and I want to get some medicine right now. No, so it's going to kind of make them feel unsettled and they have to.
Yeah, man. There are times I do take persons into the counseling room, um, or the confidential room, just to let them cry.
Yeah.
Just to let them cry. Simple as this on a daily basis or a monthly basis. You have customers come in and you can see it as they enter, the eyes full in water. You just take them in the room, just let them cry, tell them everything is going to be okay. You counsel them about the medication, why they should take this particular medication, how they will feel after taking it, and tell them that, hey, this is not the end of it.
And how does that, as a person, as a professional as well, how do you balance the work life? And because having to deal with persons and their emotions and all that, how do you go home after that and feeling like, okay, I did a good job today? I love somebody to, yeah, what's the transition there? How do you separate, you know, that?
Sometimes it is hard to separate, but for me, I come home to a lovely wife who is also a pharmacist, and we do go through our days sometimes on a nightly basis. So for me, that's how I deal with on the day-to-day problems. I'll go and talk to my wife about them.
Yeah.
It's a kind of unwind.
Okay. So, well, I'm not seeing any more questions. Guys, remember you can drop your questions in the comment. Um, yeah, man,
Somebody said, "Whoa, Mrs. Brown, man."
I'm Mr. Brown right now because I have a coming with both prescriptions. But yeah, very insightful. What is there anything that you would share? I'm kind of getting a feedback. I'm not sure if there's something else that you have. Um,
Um, I don't
no.
still hearing it.
Yes. Well, I'm not sure what's happening, but so yeah, kind of hearing myself. I hope everybody's hearing me clearly. Can everybody hear me and hear this? Yeah, I'm
Yeah,
hearing
I'm hearing you clearly.
the feedback is not that clear on the viewers in that. But yeah, I was gonna ask, is there anything that you would share with anyone who's interested in going to medicine, be a pharmacist, something that if they're probably not sure if it's what they would want to do, but you yourself, based on your conviction, you want to go so early, what made the difference for you? Anything like that?
Um, I would tell them if they're not sure exactly they want to go in the medicine field, you have to ensure that you at least have the option of going into the medical field. So that would be getting your science subjects first. So, so the chemistry, the biology, the physics, all of that, you have to put yourself in that position to know that, hey, if I really want to do this,
Yeah.
I can. And so, in the case where I was in at St. James High School and I did business, would have taken a lot more time, to go into medicine. I should have been easier to go into
Yeah.
medicine. So I will start there at education, and then I'll ask them to seek out a mentor, talk to different. Well, that's why we have this platform, Minds of Jamaica. Talk to a pharmacist, talk to a doctor, reach out. Ask them any questions you want. Ask them about pay. Ask them about money. Ask them about their daily work schedule. Ask them how they balance their time. And then just go home and do the research and see if this is something you
Yeah.
can really manage or handle.
Because it's they're
And
persons who just like you when they're at the age that you decided they probably want to know, and they're probably passionate about it just the same about the sciences, and seeing you talk about your experiences, and you're still in and I'm not sure if it's something that you plan to continue right through, but you know, um, possibilities are endless in the career. I didn't
yeah,
know
man.
some
Yeah,
of
man.
some of the things that you mentioned as it relates to what the requirements are for pharmacists, because I was thinking, or I would be thinking that this is a different career, this is a different profession. Don't call them pharmacists, you know. So that's
Mhm.
something that it kind of opened my understanding to the different areas career that you can get into. Yeah, man.
Yes, man.
It
Definitely.
was great, hearing um, that you have shared. You know, I'm not sure if there are any more questions because there are persons who are just joining, but I'm gonna open the floor again if there's anyone who would like to ask Mr. Fray any questions. Um, if not, this interview will be on the Mind of Dominica page. You can always share it with someone who you think might be interested in hearing about being a pharmacist. It will also be on our YouTube page, on the Mind of Dominica page. You can watch the full interview as well. Also, bear in mind that Mind of Jamaica is a website that you can sign up if you are interested in a specific career field, or if you're not sure what you want to do, you can always sign up. A mentor will assign to you, or a mentor will be assigned to you, and that person can help you to navigate through the process, transitioning from secondary to tertiary education. Um, if it's even that you want to start a little, uh, I don't want to say little, I don't want to really play. However, if you want to start a business, you know, even though he's not
Oh,
he's still in business, but he's in medicine.
that, and that's another thing, that's another
Mm.
aspect of pharmacy too, which in touch on. A lot of pharmacists are to become a pharmacy owner when you're a pharmacist,
Yeah.
and you'll be doing business for yourself.
See there? So I guess how close are you? Because you're on the way to owning your own pharmacy. Yeah, man. Thinking it
Oh,
easy. Yeah, man. Oh, yeah. Jerome, it was a great conversation. Rochelle said very insightful conversation. Yes, I'll second that. Um, and
it
you
was
know,
a pleasure.
uh, yeah, man. All the best, and for everyone who is joining, make sure that you are following the Minds of Jamaica page and for any updates or anything. Also, you can reach out and we can whatever assistance you may need, advice and all of that stuff. So yeah, we're at the end of our discussion. No more
For
questions.
having me.
Say that again.
I was saying thanks for
Yeah,
having me.
man. Yeah, man. It was a pleasure, bro.
Yeah, man.
So yeah, informative and perceptive. Watch me try read. Interview with one of the best pharmacists out there. Yeah, man. Great information. All right, guys. Yeah, man. Thanks for joining again. And Minds of Jamaica is out.
All right. Take care, guys.
Yeah, man.